Well, hello, good morning. How is everyone? Hi. My name is Shelly Shor. For those of you who don't know me yet, I'm the OPS program manager for the Healthcare Authority, OPS being Operationalizing Peer Support. I provide technical assistance and all kinds of assistance to agencies and organizations that either want to add peer supports to their book of business or already have peer supports and need assistance with the implementations of those services. In my previous position, I was a clinical supervisor and manager in a behavioral health agency. I'm a social worker. I'm also a parent peer, and I'm here today sharing some of my knowledge and experience as far as working and supervising peers. Let me share my screen with you and we can start with the presentation. So obviously there are a lot of important practices providing peer supervision. I'm going to focus on 9 of them that I have assembled and found to be extremely important. When we talk about peer supervision, it's if you're a supervisor and you have supervised any provider, any profession, supervision is supervision, and there is a lot of commonality and a lot of things that are similar in supervisions. In here, I'm going to talk about some of those things that are similar, but also focus on some of the things that are more peer related. And so it's important for me to emphasize those. I'm going to just dive in. What I'm going to do today is I'm going to talk about all the things. I'm going to share all my presentation and save time at the end for questions. I found that it is most effective doing that and had some requests as far as, being able to maintain the knowledge and not being distracted. We're just going to do that today, and I appreciate your feedback if that's something that you find uncomfortable or not efficient. But I will start with this today. So the first thing when I'm talking about important practices in providing peer supervision would be providing diverse types and structures of supervisions. When I say that, I mean a couple of things. First, the supervision format. We have individual, group, and co-supervision. Obviously, we probably have more than that, but I'm just going to focus on these 3. There are advantages and disadvantages for all of them. In individual supervision, we have more attention that we can provide to that one person that sits in front of us. It is confidential. However, there are less opportunities to learn from others. That's why we have group supervision. We have more opportunities to learn from others and each other, and it's also very powerful. And with peer services and peer supports, it does reduce isolation. And isolation is one of those concerns of peers when they work in a behavioral health setting sometimes, and not a peer-run organization. And so it's great in all of those manners, but it could feel unsafe sometimes to share. And there's a difficulty addressing all the specific needs of the supervisees. Co-supervision could be the best of all worlds if it's done correctly. And so the problem with that is that it could open that space for triangulation. If we have 2 supervisors and someone who wants to get their answer and the right answer for their question, they could have one supervisor answer one thing and the other answer the other, and kind of pick and choose what works for them, which sometimes works and sometimes okay, but sometimes we do need a one unified answer for questions. And so co-supervision could work great if you have good working relationship with your co-supervisor. You're on the same page, you coordinate things, you work together. It could work great. When I was doing co-supervision in the past, I did that with my peer team lead, which was a peer. I wasn't a peer at the time. And so these were 2 great perspectives to have for those supervisees of us. That's as far as the supervision formats. I'm also talking about some functions of supervision, and this is an artificial distinction between some types of supervision. Obviously, we have topics that could be all of them. We have administrative, educative, and supportive supervision. Administrative supervision focuses on, effective implementations of the agency's policies and procedures and management of the CPC's work performance. So we delegate work in administrative supervision, we monitor and evaluate performance, and work with topics like time management, record keeping, documentation. It's very important to have administrative section for supervision. We also have educative section for supervision. And these types of supervisions focus on professional development of the worker through training, modeling, and structuring, and all of those structuring all these learning experiences. We focus on knowledge, skills, and attitudes. We provide individualized training and support. We provide workers professional development and more. You can see that, for example, documentation could be both a part of the educative supervision and the administrative supervision. We'll learn those skills and then we monitor them. The third type of supervision is supportive. And that's the supervision that focuses on the person's morale and job satisfaction. We give feedback on the work, we validate, we provide encouragement, we promote self-care practices and advocate for the CPC role. I'm going to talk a little bit more about some of these aspects in the future in here today, but really there's a lot of aspect of the supportive supervision in the peer supervision. So that's what I meant when I was talking about providing diverse types and structures of supervision. The second practice is ensuring that supervision is consistent, accessible, and helpful. I say that all the time. The most important thing about good supervision is that it happens. And we know that things happen in our life, in our professional life and private life, and we have to cancel supervision sometimes, but it's very important that we reschedule those supervisions. When I received supervision, and I still receive supervision, canceled supervision, it's not great, it's not fun. It's sometimes it does feel like, oh my gosh, I'm getting an hour back. But really, when you have a good supervision and it's there and it's accessible and it's safe and you can talk about the things that are really happening and get that good advice and good support, there's nothing like it. And so it's important for us as supervisors to provide that supervision. And we need to remember that supervision is also the peers' responsibility. We want to manage up and we want to encourage the peers that come to the supervision or anyone that comes to supervision to come prepared with their list, with their questions, with their attitude of learning and growth, because that's the only way to get your money worth from supervision, so to speak. I want to talk now about watching for and redirecting peer drift. You probably heard that term before, some of you may not have heard that term, but it's very important, it's very specific to the peer role and to the peer supervision. Let's talk about the peer identity and the role drift. It's important to talk about that because this is something that actually happens and happens all the time. The peer supporter is not a therapist. We have to remember that. Their lived experience allows them to fulfill a unique role, but this role may be in conflict with the traditional medical treatment models, and that's a lot of the time where peers are working in a behavioral health setting, that the norms and the language was determined by the medical professions. And so drift can occur when the peer supporter does not feel comfortable in their role and they begin to shift towards a more medical treatment model. For example, focusing on problems, barriers, symptoms, and diagnoses, rather than on strengths, skills, and opportunities. Supervision should periodically shadow peer supporters to guard against peer drift, not necessarily, but definitely necessary to talk about it and pay attention to that. So when you have a peer sitting in front of you as a supervisor, they start to use the language that everyone else on the team uses, which is clinical, which focuses on diagnosis, that's when you know that a shift is starting to happen. Now, I understand that sometimes that's the culture of the organization. It is. However, we do need to be mindful of that because we have plenty of therapists. Well, not these days. We have therapists, we have med providers, we have case managers. We want to have peers that are peers. We don't want to have a junior therapist working as a peer. And so you might need to, as a supervisor, change your language when you provide supervision for peers and use more. We always want to use person first and strength-based language, but be more mindful of the content. If the peer role is to provide support and share their lived experience and work on strengths, that's how the supervision needs to look like as well. We don't want to be over professionalizing things. We want the peers to work as peers. And I can't stress that enough. And you might have questions about that. And please write them down or keep them to the end. And I would love to address any question that you have about peer drift. The fourth practice that I'm going to touch on today is collaboratively assess strength and areas for growth. And so when we talk about peer supervision, I talk about strength-based supervision. We're not ignoring the challenges, but we are reframing them as areas of growth, and we emphasize the strength. And so supervisors need to have the capacity to give and receive feedback. We're going to talk about that. And that's not easy as well. But by doing this in a safe manner, we talk about, creating that environment where we could share, we could receive feedback and provide feedback. The strength-based approach basically is something that needs to be consistent and provide recognition and praise for competencies that are developing and successes and great outcomes that we see in front of us. I'll give you a couple of examples. I took that slide from the STEMSA toolkit for supervision of peers, and I recommend taking a look at that as well later. One example that I like is the recovery plan you developed with Ian showed that you really understood how to do person-centered planning. So when we give that feedback, it really needs to be specific. It needs to be timely and individualized and genuine, obviously. We also want to add the component of actionable because this is how we create growth. And this is how we see people moving forward and taking that feedback and doing something positive with it. Another example, you showed a lot of courage when you reminded the team that Nathan has a right to make an informed choice about which recovery home he wants to go to. And that's a good point because sometimes peers are sitting in front of other providers that talk about, disability. They talk about symptoms and they don't see the whole picture and they don't see sometimes the narrative and the story around and about that person. And so when a peer speaks up and can share these other aspects of the human being that we are serving, it takes courage and we need to acknowledge that and show that. And so that's a good example to show, both. We don't want a peer to just talk about clinical symptoms in a team meeting. We want them to share. We want them to advocate. We want them to be there and represent the person that might not be in that room. And when I say we want them to share, Obviously, the peer shares whatever they want and feel comfortable sharing. We never ask a peer to share their experience in a meeting anywhere. If a peer wants to do that, they can do that. That would be wonderful. But we do not impose that sharing on anyone else. Just a point that I wanted to make. Not necessarily has to do with the strength-based supervision. One point that I want to add here, and it goes to everything that I'm saying today, is modeling. When a supervisor can model a lot of these aspects that that go about, the strength-based, the giving feedback in a safe manner, and receiving feedback, that goes a long way. And that's a lot, we know that modeling is one of the best ways to learn. And so if the supervisor in the supervision of the peer is doing everything in a very strength-based, positive way, we know that the peer can take that and work the same way with the people that they are serving. And so it's important to remember that, to remember modeling, and remember parallel processes. Moving on, I'm going to talk about these two practices together: familiarizing yourself with common concerns of peer staff and holding peers accountable for recovery values. There are a few concerns that are common for peers that I've heard from peers about. One of them is isolation and the lack of integration with the other staff. Sometimes, and it has to do also with the lack of a clear role that is advertised to the rest of the team. And so we start with the fact that the supervisor and the program administrators need to know what the peer role is. If they do, they can communicate that to the rest of the team. If they do not, and the rest of the team is not familiar with the peer role, there could be some competition or resentment or even fear. I remember when I worked as a therapist and we had peers and I didn't know what the peer role was. I was a little worried that the people that I'm serving will like the peer more and then don't want to work with me. Not saying that it didn't happen at some times, but here's the deal. The peer role is complementary. And the therapist role is complementary as well to the peer role. And so we all do different things. And if we know that, it will help integrating peers into the workforce. The peers will feel less isolated and have more voice, more power. We need to pay attention to that on a regular basis as supervisors and program administrators. And so paying attention to this, paying attention to lack of career advancement, we're going to talk about that in a minute. And making sure that we utilize the peer and their lived experience as they work in our agency and our organization. When I talk about holding peers accountable for recovery values, I talk about, embracing multiple pathways, assertive outreach, serving people by supporting them in determining their own goals. It's really important that the peers do not determine goals for the people that they serve. It's important for everyone not to do that. But we want to pay attention to that because peer services are voluntary. And so we want to maintain that aspect of voluntary service, working with that person, providing a lot of services that are community-based. When I talk about embracing multiple pathways, I talk about, maybe that peer has a lived experience with SUD and with abstinence, and that's how they recovered. That's why they're in recovery. The person that they work with might have chosen a different path, an MAT, medication assisted treatment. We want to make sure that the peer respects that, embraces all those multiple pathways, and we want to hold the peers accountable for doing that. With assertive outreach, I know I said peer services are voluntary, they are. But what is assertive outreach? if we are trying, we work in a certain setting when we see a person for the first time that we would like to serve, we offer our services. That person might not want to work with us. He might not want to work with the peer today, or yet. That's why we want to try again. We want to offer services again and again, not to be a nag, not to be a nudge, but to realize that people change their minds, and that when they change their minds, we want to be there to support that help. We don't want to be insulted. They didn't want to work with me. We don't want to say, it's done. They said no once. No is no. Yes, no is no. But no might be maybe later. And so we want peers to be that person that doesn't give up on others, even if they said no the first time. So we want to pay attention. There's a lot of stress between voluntary work and assertive outreach, embracing multiple pathways, respect, all of these things. We want to pay attention as supervisors. And there's a really good resource that I could share with you later that talks about the peer values and how it moves from values to practices in the field, and how the peer is responsible for doing some things, and how the supervisor can also monitor that and support the peers with that. The next two practices are helping peers with development of time management skills and documentation skills, and also supporting continuing education and career mobility. We know that there are issues with career mobilities for peers. And I'm going to mention a couple of ways that we as supervisors and administrators could support them with. But I'll start with continuing education and improving skills. So let's just move to this slide and I'll talk about it in the next slide. Supervision is great. And that's how we work with peer supporters and CPCs, and helping them improve skills and knowledge. And, you know, in my experience, supervision was the best way to propel my knowledge and my skills. However, it doesn't have to stop there. We have a Peer Pathways annual workforce development conference that happens every year. It's wonderful. We have peers there, allies, supervisors. Typically it's in August. It's a 2-day conference, and peers are welcome to come in. Anyone is welcome, but peers specifically are welcome to come in, network, learn, and connect. And it's highly recommended. We also at the Healthcare Authority's website have a section for continuing education. Currently, we know continuing education is not mandatory for peers. I do recommend that. I recommend that for everyone to keep learning when they are working in the professional field. And so currently we have continuing education on documentation, ethics and boundaries, the intersection of behavioral health and the law. We have continuing education on supported employment, education, crisis that we just finished developing. And so these are all great courses that the peer can take. I will mention that supervisors can take that as well. I feel that specifically ethics and boundaries and documentation are critical and always a good idea for supervisor of peers to take, because that's how you follow and can support the peers in propelling their skills. And so it's highly recommended. It's on the HCA webpage, and we can put the link there later if you could benefit from that. When we talk about career mobility opportunities, we know that sometimes a peer can feel stuck in their position. If you in your agency and organization can support them in their career mobility within the agency, that is wonderful. Some ways to do that is to create a tier system where, like some places have case manager 1, 2, 3, you can do that with peers sometimes, and think about the criteria and sit with the peers and try to think about the criteria. We tried doing that in my agency prior to working at the Healthcare Authority. If you could promote someone to be a team lead and supervise peers, that could be a wonderful way to learn more and develop in your current position. If there's no way for peers to develop in the agency, some of them are bound to leave. That's just how it is. And so supporting those people that think about moving up or moving out or moving sideways in other places, and supporting them by helping them improve their skills, maybe build their resume, that could be really just a good practice for supervisors to support anyone. Yes, we want to keep you here in the agency, but if that's not a possibility, let's see how can I help you promote yourself, because that's just a fair thing to do. And then I'm going to talk about the final number 9 important practice in providing peer supervision. Let me tell you, it was hard to have 9. I'm a very symmetrical person, and I was like, I need a 10, but we have a 9. And that's promoting self-care. My working definition for self-care is the active process of making your body and mind a pleasant place to inhabit by filling your own cup first. This ensures you have enough to give others. And so obviously we can't pour from an empty cup, and we want people to not get to these places where self-care is not even an option anymore. We started talking about self-care in the interview. When we interviewed people, we asked them about what is self-care to you and what do you do, and then held them accountable for doing that self-care when they were working, and supporting them with that. I want to talk about a couple of situations associated with the caregiver role and how self-care can support people with that. So compassion fatigue, or secondary trauma, as you might know, is defined as indirect exposure to trauma through a first-hand account or narrative of a traumatic event. Burnout, big word, is a condition experienced by all professionals in which they develop depression-like symptoms as a result of aspects of their role. Burnout may manifest as showing signs of physical, mental, and/or emotional exhaustion as a result of stress related to their job or workplace. And so burnout, or occupational burnout, is a psychological term referring to a general exhaustion and lack of interest or motivation regarding one's work. Compassion fatigue, also called secondary or vicarious trauma, refers to the negative emotions that individuals feel from helping others at work. Burnout is a real thing, and we all know that. We all felt that. And it's kind of something that people say, well, it will happen. It's not if it happens. If you stay long enough in the working in the professions that we chose for ourselves, burnout will happen. And so self-care could be a great thing to help with that and to treat burnout. However, I want to talk about preventing burnout or postponing burnout, and self-help could be a way to prevent. We know today that we have rep plans for work. We have employers assistance programs, and these are just a couple of formal ways to go. We really want to ensure that people have a balanced life work ratio. And so we want to make sure that people take the time off, that people have good boundaries as far as their work and their life, and helping people, to figure out what is that good balance for them. Self-care could be helpful, like I mentioned, in preventing burnout in some of the following ways. There are many ways. These are just a couple of examples, like asking for help, spending time alone, putting yourself first, setting boundaries, saying no, forgiving yourself, asking for help. And you probably know this slide as well, that there are different types of self-help: physical, emotional, social, and spiritual. And I want to share a resource that I utilize, and it is self-care assessment, and it's on the Philadelphia Toolkit. Actually, I'm going to share it in a minute, but it does talk about all these aspects of self-care. And I'm just going to move on to the next slide and talk about that, and then move to the self-care assessment. Supervisors can help. They can help by regular check-ins and being that person that in supervision can ask about self-care, that asks about burnout. Supervisors can help by building the team, have team building activities, and if you have a good team, the support doesn't just fall on the supervisor, and the peer can get support from multiple people. Also, we talk about an open door policy. It's a little tricky in this era of sometimes virtual doors, but keep your virtual door open if that's the only door that you have. We want to discuss self-care and burnout in every opportunity. It's not going to be problematic to talk about burnout because you think that if I don't talk about it, it doesn't happen. It will happen. And so talking about self-care in an ongoing manner could be helpful. Talking about boundaries and clarifying all of these things that the peer should or should not do if they are not helpful and they are hurtful for them. We want to remember, the one thing that was creating a lot of burnout, in my experience, was working harder than the person that you serve. And I don't like the way it sounds sometimes. However, sometimes it's true. When you feel like you're working harder than anyone else, it creates that resentment and burnout, and sometimes even trauma. So we want to keep everyone doing what they need to do, discuss opportunities for self-care, and we want the supervisor to model self-care. If you as a supervisor can do that, the peers learn from that. The peers understand that it's okay to take care of yourself, because sometimes in the work of the workforce of workaholics or people that are service providers and just give and give and give, we forget to stop and give to ourselves. We also want to make sure that us as supervisors are not the only support that a peer will have. So I mentioned that we want to build that team. We want to make sure that the peer builds their own networks of supports, and so it doesn't create burnout for the supervisor as well. Oops, sorry about that. And so here's the self-care assessment that I was mentioning. I will actually stop this share and share the thing itself. And you should be able to see that. Do you? Let's see. Can you see the questionnaire?
Yes, we can.
Oh, great. Wonderful. Thank you. So you can see that we have physical self-care, psychological self-care in here, emotional self-care, spiritual, and workplace or professional self-care. And also a little section about balance, which is also fantastic. I used to do that myself. I used to do that in individual supervisions and in team meetings. And we used to do that every 6 months and see what are the things that have changed, what are the things that are still the same, what areas do we do better in or not as good. And it was a really cool, helpful tool. And again, I can share that with everyone when we are done here today. And so to sum everything up, these are just 9 of the practices that I use, that I encourage supervisors to use. And this is the time for us to see if we have any questions or comments. And please, you can unmute yourself, or you could write whatever you want to write in the chat. And let's start. We have about 15 minutes for that. I will send all the links in a follow-up email and a PowerPoint. And I do see that Amanda has put the continuing education in the chat for everyone to see. I'm also going to put in the chat, again, the link for my question. I want to know what are some things that are interesting for you in the next webinars. So I can both.
I don't necessarily have a question. I just want to say thank you so much. I just started supervising a peer. This is very new to our program. And between her and I, we're trying to figure it out. But these guidelines have been a huge help because this is very, very new to me. It's a very different supervision than case management supervision. So I very much appreciate this.
Thank you. I appreciate you saying that. You know, it's sometimes difficult to know what is the most relevant thing to share, because there's just so many things that are happening. But this is a great feedback for me, and I appreciate what you were saying. You can see I shared on the screen the QR code for the Menti. If you want to even take a picture of it on your phone and you can answer the question, I would truly appreciate that. I also want to mention that I have office hours every Monday from 1 to 2. Some of you are aware of that and have been there. I recognize your names and faces. Well, not faces, not a lot of faces here, but hi faces. I appreciate you being here. And in these hours, you are free to come in and leave whenever you want, come in with a question or just to listen and network and work with other people in your situation and your role, maybe. So everyone is welcome, and I will put the link for this link to join for that as well. I'm gonna mute.
Hey, Shelly.
Yes.
Annetta wants to know if they get CEUs for this training.
Yes, so the answer is no. You don't get CEUs because peers don't need CEUs. They don't need to renew a license. But yeah, I absolutely understand why you would like that and you would want that. These do not count for any other profession CEUs. So the answer is no. But you get a lot of great tips and knowledge, especially as a new supervisor. But let me tell you, I've supervised peer for a long time, and I've done these trainings a year ago, and I learned so much. They're easy, they're great. Yes, you will get the PowerPoint. I will send that, absolutely. I am working on building a new training right now. So my training is about an 8-hour training. and it's for supervisors of peers or peer administrators. And it is very flexible, so it's not a full day of training. I usually do 2 half days or 3 trainings of 3 hours, and I talk about all of these things. This is one of my slides in the training. This is just one part of it. We talk about the peer role, we talk about the laws, the WACs, talk a lot about peer supervision ethics and other concerns that arise. So if you are interested in a training or joining a training in the future, just let me know, email me. I'll put my email in the chat, and I will put you on my next list for training. I think I got it.
Okay, Shelly, there's some more questions in there.
Okay, thank you.
So when, let's start. I'll start with Carrie and move up.
Okay.
So will the HCA bring back in-person peer training, such as wrapping up the trainings like in the past? Would you like me to answer that?
Yes, please, can you? Thank
Okay,
you.
yes. So right now we don't have, as of this very moment, we don't have the funding to do free wrap classes. And as you know, we don't do anything that costs money at state level outside of conferences. So we are trying to get a principles of wrap training, or kind of like an LMS learning style, just to kind of like an intro, a 101 to it. And then we're hoping moving forward, we'll have funding into the next fiscal year, which starts in July, in order to fund those in-person events. Now, the majority of our CPC trainings now are in person. We have a handful that are virtual, but I would say a good 7 out of 10 right now are in person. And this year alone, we're doing 74 trainings. So if you have staff and they need to be certified, please make sure to reach out to myself or to Shelly Shor, and I can fast track that for you.
So Annetta was saying, thanks, Amanda. I was under the impression that this was the CPC training, which I believe we need CEUs for. And thank you for your kind comment. But with the CPC trainings, we do not need CEUs for. So to take the CPC training, you do the prerequisite and then apply. Send your completion of the prerequisite and application to Mary Chambers, and then you get the invitation to participate in the CPC training. We prioritize the applications and send those invitations. We try to do that as fast as possible, and we have a lot of trainings that are opening this year. So hopefully we can get everyone as fast as possible. I really liked Alicia's comment, which was so unclear because her dog was stepping on her laptop. And I relate to that. My cat schedules so many fake appointments for me, just stepping on my laptop and my keyboard. And I'm like, who scheduled? My cat did. So,
Yeah,
but
sorry about that.
no, that was great.
No, it's
She's just
wonderful.
a baby Chihuahua. Yeah, she's all over the place. Yeah.
Oh, my baby's like 90 pounds and
Oh
pushes
my
me
God,
around.
she's break your keyboard.
Annetta, Annetta sorry, I guess I'm sorry, would love to be on the training in the future. Which training do you mean, Annetta?
Just any, can I?
Yeah.
Okay, perfect. Just any of the trainings for the certified peer counselors, just any like new updates and stuff that we have, you know, any new laws that come into effect, anything like that. I've been a CPC for a couple of years now, and then I'm also an SUDP.
Okay.
So any new trainings, I know that for my SUDP, I have to have CEUs every year. And somebody told me that there was a training that was coming up for CPC so that we could have so that we could get our CEUs. And I was like, huh, I wonder if that's new. So I was just checking on that.
Thanks, Annetta. Thank you for the good work that you're doing too. So if Do you have access to our continued education through the website? Because that can be something that will help with that too. And then we do have a crisis, peer support and crisis training that is 40 hours, but I believe it's full for February. And then moving forward, we'll try to have that funded as well because it's part of the governor's language. So, you know, we have a peer-to-peer newsletter, and then we have a peer blend webinar, and we do updates on both of those every single month. And so if you're part of the ORP listserv, you're part of our peer listserv, if you're getting the announcements through this and it's coming through Office of Recovery Partnership, then you're automatically on our list to receive the peer-to-peer newsletter and the announcements for the peer blend every single month.
Yes, and I think Annetta said that she has access to all of those.
Oh, perfect. Okay, so yes, that's a really great way to, we try to stay as transparent as possible and put information, especially in the peer-to-peer newsletter, that would help with numbers, et cetera, et cetera.
I have
I'll
a
be quiet.
question.
Yes, Alicia.
So right before this, I went in the system and changed my email. Will that be enough? You know, in the where the trainings are, because I'm already certified. I went through all the trainings and everything in the week training.
Mm-hmm.
Updating my email in the system where the trainings are. Will that go to you guys and I'll be able to get all my updates now on this email?
You will, as far as the listserv. As far as the training, Amanda, do you think she needs to send that new email to Mary Chambers, maybe, just in case?
Absolutely, yes.
Okay.
Or HCA, you can send it to HCA Peer Support Program, or just Mary.Chambers.
Oh, goodness. Will you
Yeah,
type that in the chat?
Yeah.
Thank you, Amanda. I just want to
Thank you.
clarify that we talk about trainings here and it's kind of confusing. We have the continuing education, we have the peer training, the CPC training, and there's also the operationalizing peer support, the OPS training. My training that I was discussing here, the 8-hour training, is mainly for supervisors of peers that could be peers and program administrators. And so if you are interested in any training, just specify which one you would like to join, because we're confused ourselves. So just make it clear in your emails or in the chat that I'd like to do a CPC training. I would like to participate in an OPS training or continuing education. The way to do the continuing education is very easy and clear. You go to the website and you just start doing that. For the CPC, as I mentioned, you take the prerequisite that there are all the instructions on the website as well. And for the OPS, you mainly just email me and let me know, hey, I want to join that training. So we're all clear, we're all on the same page. We are aware that it could be confusing because we have all these programs and all these goodies to offer. So thank you for that. I will give another minute for questions that might pop up. I see some people were writing things in the Menti. I see self-care. And talking about self-care, that's definitely a good one. I run these webinars once a month. The December one is not determined yet, but I will send you get those emails and reminders online. So from the listserv. So hopefully you could join then. In the meanwhile, I have my office hours, as I mentioned, and I will send the link to that to everyone that wants to join. I'm trying to see if I can send it right now. I will send it in my follow-up email, and hopefully I can send the recording as well. So if there's nothing else, I appreciate your time very much. Thank you for being here. And thank you for doing the work that you do. It's not easy, but if you love it, you love it. We know. And I hope to see you next time. And please have a safe rest of your November. Take care.
Thank you so much. Everybody take care. Have a great day.
Thank you. Thank you. Bye-bye.
Yes, thank you, everybody.
Thanks, Jordan.